Hey guys, so we finally get to do this. How you doing?
Good, good,
Doing good.
doing
How are
well.
you?
Yeah,
Awesome,
excited for sure.
awesome. I'm really excited to put this together and just give us a chance to talk about what we're doing over at Adaptive. Now, before we get into everything that we're building, first, I got Chris here. Chris, you want to go first? Tell us about yourself, your
Sure,
background.
sure. My name's Chris Donovan, CEO of Adaptive, and have been in healthcare data products my whole entire career, just about, except for maybe the first couple of years, where I actually was working with a health system consortium. But in any case, been focused on figuring out how to leverage technology, particularly data, to drive value within healthcare.
That's awesome, awesome. And Matt, tell us about yourself.
Good to be here. Good to see you guys. Matt Frankel, the Chief Customer Success Officer at Adaptive. Have a long background in data and analytics. Have worked both on the consulting side, also on the payer and the health system. I've been fortunate enough to work at all the different stakeholders within the healthcare industry. Focus has been on product development and also and as part of that, strategy, identification, and decision making around that. So excited to talk to y'all today.
Awesome. And for the audience, my name is Mwenge, and I've been in the SaaS space for a better part of almost 15 years now. So we have an interesting market opportunity here. Adaptive product, the name, the term. Where does this name come from? Who coined this term? Chris?
Yeah,
What?
that was for me essentially. I've been in product management, product development, product strategy for my entire career. And a key component to success is being able to adapt to market conditions. So that's essentially what it is. Is I'm very much an agile advocate. So being dynamic, you have to be dynamic and you have to be able to adapt to new information as effectively as possible. And that's essentially the culture and focus of adaptive. And that's where that name came from, essentially.
There's this new market niche that we have identified, and we're talking about decision infrastructure. What is this problem that we're trying to solve?
Yeah, for sure. So this is actually something that's been a focus of mine on the product management side. And then recently within the health system engagement, I noticed the same problem. And that is, how do you build a robust data-driven strategy? And what I found within health systems, my work within health systems is they're sitting on mountains of data, a whole lot of data. And there are a lot of different ways to leverage that data to drive value. But what I see right now is the decision infrastructure that, particularly within health systems, and again, analogous with product organizations, is not having a data-driven way to develop a strategy that's going to mitigate your risk and optimize your value going forward. What happens a lot of times with the lack of a really true, good, data-driven structure to drive that process is the loudest voice in the room or opinion-based strategies are leveraged. And the outcome of that, which is now becoming pretty prevalent, is that health systems are really not gaining the value from their data resources because of this strategy process. So that's what I see as a real key problem. There's a lot of opportunities that health systems can leverage their data to do a number of things: improve patient care, create new revenue streams to address a margin issue that they have, and optimize internal operations to drive cost savings internally. There's enormous value that's just being left on the table right now because of this decision infrastructure, lack of a decision infrastructure layer, and that's what we're focused.
Yeah, I would say every system that I've talked to has a different version of the problem, but the pattern's the same, right? Which is strategies are coming to leaders that are not comparable. They have different assumptions that are built into those strategies, different financial rigor that's built in. There's no common logic to put them side by side. And I wouldn't say that the problem is, if we want to call it fragmentation, strategy fragment, I wouldn't say the problem is a niche problem. It's for a few struggling hospitals. It's structural across the health systems. They're making these decisions that are not comparable. There's no common logic or framework from hospital to hospital.
What does that
Well,
look
I
like?
mean, when you think about it, health systems are they're federated. I'd say by nature. There's different service lines. There's hospital lines. There's physician groups, and they all have their own agenda, right? And they all have their own version of the priority. And so when we say there's nothing that a business case is not a decision, it's an argument, essentially, to get to a decision. And what happens is natively within these systems, because we've got the physician groups and the hospital, they're coming out with their own priorities. And there is nothing that is layered on top, let's say, that can help kind of make apples to apples so you can make informed decisions in a consistent way across the different units.
Makes sense. Chris, looking at the market right now, what do you think are the current drivers that are incentivizing the push for such a solution? How does this fit in and why now?
Yeah, great question. So a number of different things. One is, and I think everyone's pretty aware of the financial challenges that the healthcare system in general has. There's a lot of internal dynamics that are going on that are putting structural margin issues on health systems. For example, staffing cost. Lack of staffing happen. Outsourced staffing cost is a big challenge and cost driver. Transitioning to new payment models. This whole transition from fee-for-service to value-based care puts a lot of financial stress and operational stress on health systems, and these structural issues are here to stay. They're not temporary. So I think that is one of the biggest drivers. Plus the introduction of technology that can help stabilize this decision making. I think that's also a key market dynamic that's at play here. So there's a lot of variability, a lot of challenges that health systems have, and now there's the introduction of new analytics technology and data technologies that enable health systems to put this layer on top, which is a systematic way to evaluate and compare opportunities, so that health systems can set their priorities and then have a prioritized list of what are the opportunities that are going to help me realize our larger strategy. So I think that's a combination of the economic pressures and then also the advent or introduction of new game-changing technologies that can help health systems really drive more value from their data and their data sources. So I think that's sort of why now.
I could add to that. So, I think health systems have tools in their tool shed related to strategy, right? But they're all a bit siloed and serve a different purpose, right? Health systems have data platforms built to store and surface information. Health systems involve consulting, right? Consultants are engaged to get to a recommendation, not necessarily to give the organization infrastructure on a go-forward basis. We've got slide decks, right? We all know, we've all lived in that world. We don't need more slide decks, right? Slide decks are something to build, to present and persuade, but not necessarily to make decisions. And what I've seen happen in the industry is you've got smart strategy officers that work real hard to kind of pull these siloed tools together. That's not scalable. That suffers when you've got mass turnover in the healthcare industry and a strategy officer leaves and someone new comes in. And what they're all lacking is kind of that, like we've said, kind of that decision infrastructure that's built to help make apples to apples comparisons, or sometimes to even leverage some of those siloed tools that the systems have today.
You bring out a very interesting perspective of institutional knowledge that stays with the institution even after there's a turnover of staff. And it kind of reminds me of how pilots use checklists, whenever they're making any decision. They're well trained, they're highly experienced, but whenever there's an emergency on a flight, they'll still go on that checklist, even when things are normal. And would you think that would be a correct analogy of what we're trying to talk about here is when you say decision infrastructure, creating that sort of standardized, bespoke solution per institution? Would that be sort of like that system?
Yeah, I'd say that. And as long as we're on the airline theme, air traffic control is also a good one.
Yeah.
Which is you've got priorities coming in from different angles, and you need to land consistently and safely. You need to land those planes. So I think there's a whole lot of analogies in the one you gave, and then also it reminded me of air traffic control.
I like that one on air traffic control because the VP of strategy, the one who's internally managing the strategic priorities. Everyone from a lot of different angles have what they believe is the highest priority use case. So how do you compare across these? And then how do you satisfy your stakeholders? And this would, so it's very challenging when someone, as an example, head of a cardiology department comes in and makes a recommendation for a costly strategic investment that they assume is going to pay off over a period of time. So like, how do you compare that versus various other opportunities in a data-driven, non-opinion-driven way? So that's what I find to be a key challenge and missing piece of the component there.
Yeah, yeah, and you talk about the financial complications and implications of whatever decisions are made, and that brings in the aspect of it seems that what we're seeing is this situation where there needs to be a rigor that is akin to the financial scrutiny that goes on post implementation. Is that what we're trying to bring on the front load?
Yeah, for sure, for sure. I think oftentimes, that financial gate, let's call it, is addressed too late in the process. So what happens is exactly what you just said. Our leaders, our staff, our folks are putting, investment in their time and energy, and they're very passionate about the initiatives that they think should move forward and the business case and all that kind of stuff. And what happens is it may not be reality given the financial pressures and of in an organization. So having that financial aspect, rigor, apples to apples, as we've been saying, having that earlier on in the process is going to be needed. And then the other thing I would say that I've noticed time and time again is people lose faith in the process, the decision-making process. And so they're, again, putting time and energy to put these cases together for investment. As that gets struck down late in the process, because of financial concerns or other things, they're going to be less reluctant to continue to bring things forward and initiatives and ideas that they've got forward. So, like we said and hit home, having some of these key decision elements sorted out earlier on in the process is going to be key.
It's interesting how in everything that you guys have talked about, there's a clear picture on the aspect of sometimes strategies are available, but there is this analysis paralysis where people are over analyzing stuff, and that's because they want to make a safe choice because the budget is restrictive. And they don't want to be held accountable for something that's going to fail. That's a bad thing to have on your resume. That it flopped. And there's also the aspect of bandwidth economics I'm seeing here, where, would one of you want to talk about bandwidth economics and how it plays into this situation?
Yeah, for sure. So bandwidth economics is an important concept, for anybody looking to drive value in the market. So specifically for health systems is, they have a limited amount of bandwidth for these types of projects. Then it comes into opportunity cost, and having a good assessment of opportunity cost across a large series of, opportunities, and, how do you make those trade-off decisions essentially? To maximize the value of organizational bandwidth to create value. That's, that whole concept is, right now it's not really done in a systematic, data-driven way. I mean, to a certain point, for sure it is, by not leveraging modern technology really to reduce the risk and maximize the opportunity to leverage an organization's investment in their own staffing and other bandwidth to drive that organizational value.
Matt, you described the old model like really, really visual, and it makes a lot of sense. Now, how do we compare this old model with the new one that we're introducing here? You want to talk about that, just for our viewers to understand what that looks like.
Yeah, yeah. I'd almost sum it up in one big, and this is when you ask how did that decision get made, and what you get 9 times out of 10, it's either within the organization's political decision or there's a champion, right? In the old model, those are how decisions are being made. In the new model, we should get different answers, right? We should get how decisions are being made. It's based on a true comparison of the different ROI, and it should be based on a consistent level of data that's getting input to make those decisions. The new model needs to be more data driven. We use that quite a bit, but that's really what we're talking about here. Is we have to get to a point where it's less political, less gut feel, and more data driven. That's the new model.
That's interesting. Data driven. We hear that buzzword all the time, but then could you just, break it down here? What is data driven in this adaptive
In
solution?
this
What's the
context.
idea?
Sure. And as part of that, I'd like to talk, about the episodic nature of the current process as well versus a systematic institutional framework that is the next generation of this type of decision making. But in terms of being data driven, is what data points are used to compare across opportunities in order to make that selection of what are the projects we're going to do in this quarter, this year, that are going to drive that value. What are those data points, the specific data points? The analytics folks, the VP of strategy, we'll go back and a whole team of people will work on various models. For ROI, for example, what's the patient impact? A lot of different variables that can be assessed in an episodic type of way, in a siloed episodic type of way, as opposed to bringing a system that assesses each opportunity by the same criteria. And that criteria can go across a number of different dimensions, including data availability, staffing resources, or ROI projections, and really solid ROI projections. I think that's another key one, is having very solid assumptions and ROI assumptions infrastructure, an engine that can help accurately assess each of those opportunities for that comparative cost. So the bringing in advanced technologies, which is changing every industry. Having health systems be able to leverage those new data capabilities to increase the data points that are used in that decision making. As of right now, it's episodic analysis, good hard analysis, but it's somewhat siloed. Then another key part is what happens after that episode is done. Is that whole analysis fully leveraged in a continuing way, like from an infrastructure perspective, or does it need to be rebuilt, rehashed, the next planning cycle? How can we make that systematic to where, it really becomes a closed loop system too, where you not only can set your priorities, but in retrospect, assess systematically how those priorities performed. Another component of that.
I,
That
I'd add
data.
in real quick, Mike. I'd add into that, and Chris, as you were going through it makes me another way to kind of describe strategy today exists within decks, right? Within slide decks. If you said, "What's your strategy for decision making at an organization?" they'd probably point to some slide decks or consultants, not infrastructure, not anything that's repeatable. And in the new model, again, the goal would be, if you ask that same question in the new model is, what's your strategy decision making? It's a data driven infrastructure, not here's a 30-page slide deck that a consultant helped put us together.
And that's pretty interesting because, with the slide deck system, you give people information. Hey guys, go think about it. Make a decision on your own, and there's a lot of nuances to different perspectives coming in, and after that episodic session is done, you have a situation where that masterful, sort of closed off focus group insight and the takeaways they have from that exercise, that remains with them. And if they're not involved in the next session of a
Right.
decision being made, nobody gets to know what they discovered. So people got to learn the same lessons all over again. So it becomes very expensive.
Yes.
Kind of like paying over and over again as an institution to learn the same things that you've been learning since a couple years or many years. And so just to wrap this segment, and we'll be going to the next segment. We've looked at the old model, we've looked at the new model, and we've talked about how this new idea that we're bringing, this new infrastructure, decision infrastructure, utilizes data. And I would like to also mention, or probably ask, how we use AI in all of this, and how much of AI is involved in this. LLMs have been exploding. And can AI do this? Do we really need people? What's the difference between Adaptive's solution and AI and all that stuff going on? Would you talk about that, you guys?
Yeah, for sure. That's a great question. Really relevant question. Well, some of the most transformative technologies in the market recently, that we're all familiar are large language model engines. ChatGPT, Claude, are doing some incredible things. In their ability to derive data points essentially. From unstructured data, largely that's sort of the breakthrough. To be able to assess, all of human knowledge, not quite, but to derive data points for a variety of reasons. So they're able to derive those data points, but not necessarily to drive to accurate conclusions consistently. A lot of data points, but in any type of different assumption will lead to different conclusions. What's needed to really harness LLMs to be more effective are expert systems. So essentially inserting a layer into that LLM in order to keep decisions consistent and accurate, leveraging expert recommendations, expert analysis, expert direction to help set the correct direction for the LLM technology, which is groundbreaking. So I think that's really what our differentiator is that we're bringing to the table an expert system that sits within the LLM infrastructure to leverage that technology, but in a more consistent, persistent, and repeatable way, and accurate way as well.
So that's taking AI, then you have some layer of governance, and then Matt, to your point, there's some institutional knowledge, so I'd call that an engine, for lack of a better term. So it's sort of bringing together the best of all the worlds that are available, the experts, the consultants, they bring in their, governance experience, and then you have AI, being able to dig into multiple data forms. And then there's the bringing those two together, and that would be the engine. Would that be an accurate, description?
I think that sounds right. It's scalable. It allows you to spend more time on the actual execution and getting to a quicker decision.
I see a healthcare system that has this implemented all across, and I think over time we're looking at cost savings in the consultancy aspect.
So I think that this gives a health system this type of layer that reduces the need for strategic spend, consultancy spend on the strategy side to reallocate those resources to execution. Because it's reallocating those resources to actually deriving the value as opposed to planning on deriving the value. I think that's a critical shift within health systems that will enable them to really leverage and drive value from their data resources. To create more efficiency internally.
Wow, that's amazing.
Good point.
Awesome. Well, guys, thank you, and I'll see you on the next segment. I think this has been a good one.